Hello, my name is Rob Leffler. I'm the Vice President of Clinical Services for PCA Pharmacy. We're going to talk about the CMS 5-star rating system and specifically the health inspections domain today. There are three components that are combined to make up the 5-star rating system. Those three domains are health inspections, RN staffing and total staffing, and the quality measures. The health inspections is based on deficiencies found on annual surveys and complaint investigations. The staffing domain is based on case mix adjusted data from the MDS. And the quality measures are based on performance on 16 of the 24 quality measures found on Nursing Home Compare and from MDS assessments and hospital and ER claims. For this presentation, we're going to focus on the health inspections. The health inspections domain is actually the most important component of the 5-star rating system. This domain is updated on a monthly basis. It sets the tone for the overall score. It does include both annual and complaint survey tags. They do look back at 3 years worth of survey history and compares an individual facility to all long-term care facilities in that state. When we're talking about nursing homes, we're talking about facilities that participate in Medicare and or Medicaid and have an on-site recertification annually or annually on average. The time between those annual recertifications is usually about a year, but it can vary anywhere from 9 to about 15 months. It can also be referred to as a standard or a comprehensive inspection. They include data from the 3 most current annual surveys and any complaint surveys that have been done in the last 36 months. And it will also include repeat visits to verify corrections have been made. They use this table to codify the severity and scope of any deficiencies that are found. Points are assigned to deficiencies that are found on the annual and the complaint surveys. Based on this table, any substandard quality of care increases the number of assigned points to the number that's in parentheses in the shaded boxes for F, H, I, J, K, and L. If a deficiency is past noncompliance, and the severity is J, K, or L, then the G level points, or 20, are assigned. If a facility has a federal comparative survey, those surveys do not receive points, or life safety surveys also do not receive points. When we talk about substandard quality of care, we're talking about F221 to 225, or the resident and facility practices, quality of life, which is F240 to F258, quality of care, which is F309 to F333, and the scope of severity, again, has to be an F, H, I, J, K, or L tag for it to be a substandard quality of care. And again, those are those shaded boxes on the scope and severity table. When a facility is found to have a deficiency and it requires a revisit, the first time the survey team returns, it is not associated with any additional points. Subsequent revisits get a percentage of the health inspection score added additionally up to 85%. This makes sense because the more required revisits that are necessary, that would indicate there are more serious quality problems. Complaint survey deficiencies, if they're within 15 days of an annual survey, they only get counted once. If there's a difference in the severity, the higher scope severity combination is used when determining the number of points for a deficiency. And any complaint deficiencies are added to the health inspection scores before calculating any revisit points. CMS calculates a total health inspection score for each facility. That total score is then calculated as the facility's weighted deficiency score, including any repeat revisit points. A lower score is going to correspond to less deficiencies and fewer revisits, and that, of course, is going to mean better performance on the health inspection domain when talking about the 5-star quality. How the health scores are computed, they're weighted. The most recent annual survey is weighted more than earlier surveys. The most recent period or cycle 1 is given a weighting factor of 1/2. The period prior to that is weighted by a factor of 1/3, and cycle 3 is weighted by a factor of 1/6. Complaint surveys work the very same way. If it's from 1 month to 12 months ago, it gets a weight of 1/2. From 13 to 24 months, 1/3, and from 25 to 36 months, 1/6. So you can see that the more recent surveys are given more weight. Let's look at an example of how to calculate a health inspection score. In 2016, a facility had 2 D-level citations. We look at our scope and severity table, you can see that a D is 4 points. So 2 4-point citations would equal 8 points, with a half weight would be a total of 4 points. In 2015, our example had 4 D-level citations and 1 G-level citation. Again, a D citation is 4 and a G citation is 20. So 4 times 4 is 16, plus 20 is 36 points. A weight of 1/3 gives them a score of 12 points for 2015. In 2014, there were 7 D-level citations. Again, those are each 4 points, so that would be 28 points. Multiplied by a factor of 1/6 gives us 4.6 points for a total score of 20.6 points. These points are then converted into their star rating. The top 10% of facilities in each state receive a 5-star rating. The middle 70% of facilities will receive 2, 3, or 4 stars. That 70% is divided into 3 equal categories, about 23 1/3% each. And the remaining 20% will receive 1 star. And again, those percentages are looked at within individual states. You'll see with staffing and quality measures, it's not just within the individual state. Those percentages or those points are determined by the cut point tables. They look at the overall scores from all the facilities in the state and divide them out by those percentages and determine what the cut points are. So in February for Indiana, for example, you had to have less than or equal to 12 points to be a 5-star facility for the health inspection domain. It is recalculated monthly. A rating, though, is held constant until there's a change in the weighted health inspection score for a facility. So if a facility is 4 stars in February and the cut point changes in March, they do not get a change in their star rating until their health inspection score changes. What can change those individual health inspection scores? A new health inspection, a complaint survey that has additional citations, if they have a revisit, if they have an IDR that changes the scope and severity of a deficiency, or they may have had deficiencies that aged out. So a complaint survey that moved from 12 months ago to 13 months ago would change its weighting from 1/2 to 1/3, for example. Each state has their own cut point tables. You can see here the cut point tables for Kentucky, for Michigan, Ohio, Pennsylvania. Those tables are available through the CMS website. We'll show the website at the end of this presentation. So it does get changed on a monthly basis. When you talk about the overall rating, combining all 3 domains, you start with a health inspection rating, and then 1 star can be added to the health inspection rating if the star if the staffing rating is 4 or 5 stars, but it also has to be greater than the health inspection rating. So if they have 3 stars on health inspection rating and they have a 4 or a 5 on staffing, then they could get an additional star. You also subtract a star if the staffing rating is 1 star. So that rating from the health inspection can go up a star or down a star, but the overall rating can never be more than 5 or less than 1. After adding in the staffing rating, then the quality measure rating is added. You subtract a star if the quality measure rating is 1. You add a star if the quality measure rating is 5. And again, the overall rating cannot be more than 5 or less than 1. If the health inspection rating is 1, then the overall rating cannot be upgraded by more than 1 star based on staffing and quality measures. So if they were 4 or 5 on staffing and a 5 on quality measure, the most that they would be able to get is a 2. If a facility has no health inspection rating because it's too new to have 2 standard surveys, then they're not going to show a rating for any domain. If they are missing data from a period, then the score can be based on available data, with missing survey data being weighted, distributed evenly based on their 2 existing surveys. So they can, when they have 2, it doesn't have to be all 3 cycles. In that situation, the most recent survey would get 60% of the score, and the prior one would be 40%. But again, if they only have 1 standard survey, there will be no composite rating, and there will be no staffing or QM or quality measure ratings taken into account. Here are some CMS websites that are very helpful when discussing the 5-star rating system. There's Nursing Home Compare. At cms.gov, it's very easy to find the state cut point tables for the health inspection domains. And a lot of this presentation is taken directly from the 5-star quality rating system technical users guide, and there's the website for that. If you do have any questions about the 5-star rating system, the quality measures, the staffing, or the health inspection domains, please don't hesitate to reach out to myself, Rob Leffler, at pcapharmacy.com or Natalie Dom at pcapharmacy.com. Thank you very much.